Hello and welcome to Noah TV. This is Dr. Zama Mobani coming to you again with one of our FICAP scrolls. Today we'll be discussing menopause, genitourinary syndrome of menopause, and monolith attach therapy. So in my last video, I went at length into introducing menopause and its symptoms to the woman as to how it affects us and an encouragement of what we can do about it. Today I'm going to introduce to you what we in the world of urogynecology now refer to as GUSM, which is short for genitourinary syndrome of menopause. So with advances in medicine and science, we've come to realize that the menopausal woman exhibits some symptoms of urogynecological ailment that is peculiar just to her. And it's peculiar to her even from mostly the exit of estrogenic input to our pelvis. Hence, the description of a conglomeration of symptoms and signs into what we call the genitourinary syndrome of menopause. As the name suggests, it is a syndrome, which means that it's a conglomeration of symptoms. And also, as the name suggests, is genitourinary, which means that these symptoms affect both the reproductive and genital system of the woman, as well as her urinary system. Just to recap, the vagina leads into the uterus, and the uterus is directly attached to the tubes and the ovaries in our pelvis. The anterior vaginal wall shares the same wall as the trigone and the lower part of the bladder, as well as the entirety of the urethra. So the vagina is actually an invagination into the pelvic floor, and when the baby or the female child is developing in utero, it shares the wall anteriorly with the bladder and the urethra, and posteriorly with the rectum and the anal canal. So when we mention GUSM, it shows us, it tells us a conglomeration of symptoms that are attributable to the exit of estrogen to our pelvic floor that results in ailment of both the internal reproductive organs, the external genitalia, and the lower urinary tract, plus or minus the lower colonic area. What are the symptoms you would want to expect from GUSM? First and foremost, there's vaginal dryness and what we refer to technically as vulvovaginal atrophy. It is the slow but continued regression and attrition of the vaginal wall where the hitherto stacked stratified squamous epithelium of the vagina slowly loses its stratification and ends up actually in severe instances being a simple squamous epithelium. That is a vagina that is not able to take the insult of sex anymore. And I say it's an insult of sex because yes, sometimes it's insulted, not assaulted. But that thinning out vagina is not able to withstand sex without discomfort, pain, or even severe pain, because the cells are no longer stacked microscopically and they are just feel like our normal skin cells, one cell squamous epithelium thick. Also, part of the symptoms of it is the urinary system, where the bladder ails and can result in overactivity of the bladder, spasms of the urethra, urethritis, urethral syndrome, problems with urination, problems with urgency of urination, frequency of urination, urgency incontinence, even stress incontinence, because the muscles around the urethra do not feel taut anymore. Any postmenopausal woman would agree that if they don't keep up in tippy-top exercise fashion, all their muscles get a little limp. That also affects the muscles of the pelvic floor. And when these muscles get limp and are no longer toned up, then they start to show ailments of the organs that they surround. In the urethra, it could present as stress incontinence as well. So incontinences of all kinds tend to be more preponderant in the postmenopausal woman, and also bladder irritative symptoms like urgency, frequency, and spasms, and also urinary tract infection. And the recurrent nature of it is also almost a pathognomic feature of menopause. Then what about the rectum and the defecatory system? Fecal incontinence also becomes preponderant in this age. The nerves around the pelvic floor ail because they don't get as much blood anymore because we've been forgotten. We are no longer the citadel of life. So a lot of overactive bladder, neurogenic bladder, the nerves to the blood are not working well, and then by default, downstream, the nerves to the anal verge don't work well. So lots of fecal incontinence, lots of proctitis, diarrhea, new onset irritative colonic symptoms. You go between diarrhea and constipation. You're not able to control the caliber of the stools anymore. All these are a conglomeration of symptoms that result in genitourinary syndrome of menopause. And here at Newer World, we have a novel technology called the monolaser touch therapy that can be used to actually revert all this process. It is our new fountain of youth. We can actually force your body to bring back you to that area, to give us more relevance, to bring back blood and turn back the hand of the clock in that area using this amazing technology. So should you be suffering from this, what we'll usually do for you if you're a candidate for it is that we'll give you some estrogen cream, just that replenish what is lacking there. I'll talk to you a little bit about it when I come into the room, and then finish you up with the fractional carbon dioxide vulvovaginal therapy that will essentially give you back your life. And we encourage you to keep up with it on a yearly basis so you don't have to ever deal with these problems that I mentioned. And I want to end that if you leave these problems alone to persist, some of them can actually lead to cancer, lichen sclerosis, dysplasia of the vulva, leukoplakia of the vulva, and even vulval cancers. These are all related to extreme lack of estrogen in the aging woman. Thank you for listening, and I'll see you in my next scroll. This is me signing off. Bye-bye.